v-am regăsit, doamnelor, domnilor, aici la Sănătatea fără frontiere. Deja v-am obișnuit săptămânal alături de noi în studioul Observatorul Prahovean, medici de top din Turcia. Astăzi cel mai bun medic neurochirurg de acolo din Turcia. Este vorba despre profesorul dr. Akin Akakin. Vom vorbi despre tulburările de mișcare. Hello doctor, nice to see you, nice to talk to you. How are you?
Thank you very much. Nice to see you. I wish to everyone a good day.
You too, there in Istanbul. Doctor, as I said, you are the best neurosurgeon there in Turkey. Hope I didn't exaggerate when I said that. And we'll talk today about movement disorders, because you are a neurosurgeon and you can tell us more information about this subject. And my first question for you, Dr. Akakin, is which are the first disorders that come into your mind when we talk about movement disorders, as I said?
Okay, movement disorders are a very complex topic, and the neurologist actually interested with this disease. But I am neurosurgeon, and after the neurological evaluation, sometimes the patients are need to my surgery. And if we think about the movement disorders need to surgery, basically Parkinson disease and dystonia disease and the essential tremor disease come to mind. And then mostly I am making the surgery to Parkinson patients. Approximately 90% of my patients are Parkinson disease. And but of course we are making the operation for chorea, epilepsy, major depression, and obsessive compulsive disorders, and all of them are included in movement disorder surgery.
Dr. Akakin, please tell me, do you know the frequency of dystonia? Because you mentioned dystonia earlier.
Yeah.
This type of cases in our country, here in Romania?
Mm-hmm. Dystonia is a very serious disease and impairs the quality of life very badly, and it has many reasons, and the most frequent ones are congenital. But there are some genetic factors, but there are mainly two genes that identified in dystonia. It can be acquired and congenital, and mostly patients are acquired patients. And dystonia in the world seen in 1 in 10,000, and
1 in 1,000, you said?
Yes, and then very common disease in all over the world. Patients are getting generally physical therapy, neurological medications, but if they don't have any benefit from this, they are good candidate for surgery, movement disorder surgery.
In these cases of persons who suffer of dystonia, can we talk about the genetic factors?
Yes. Actually, mostly the scientist doesn't know where it comes from. It can be genetically and acquired, and genetically just two genes identified. So if we identified these two genes, we can say that it can be familial. But if doesn't, it's we have to think about the acquired dystonia, and especially these patients with the dystonia has no general genetic factors. We can't identify it in patients. So we are saying that you have a dystonia and it's acquired. And mostly hypoxemia in the brain, and trauma, and cerebral palsy, and toxications can cause the dystonia.
In cases of persons who got married and have blood connections, let's say, is there a problem? It can cause this disease?
Yeah, some genetic factors are autosomal dominant. So, if you have a get marriage with the dystonia patients that carrying these genes, if you make a marriages, it can be cause a familial passing of this disease, of course.
Doctor, please tell me which are the indications when we talk about SSI meet the brain pacemaker?
Mhm. Okay, and pacemaker is approximately in all over the world history is 20 years something, and in our country I was doing this surgery in 15 years, and then in this history I made more than 500 cases in my country, and then
Of
in
people, sorry, doctor, of people who have brain pacemakers in your country,
yes,
500?
yeah. More than 500
More than,
cases. Yeah.
okay.
Yes, more than 500 cases. And then we are making in this surgery with the products of high technology. Uh, when we compare the pacemakers in the surgery, it is increase the quality of life approximately in their life in 10 or 25 years. He are getting more high quality in their life with the pacemakers. And then,
That's a
if
good
we talk
news.
about the pacemaker, it's uh, insert installation to the patient with local anesthesia. We are not giving the general anesthesia to the patients. We are making awake surgery, and then in the operation room, patients are seeing the benefits of this stimulation, these pacemakers in the operation room, while because they are awake, and they are saying that, okay, doctor, right now it's good to us, and we are saying that we are making the surgery like this. This is awake surgery, and then so we don't have a risk of anesthesia in the in this surgery, and then if you have another question.
You anticipated my next question. I wanted to
Hmm.
ask you what are the benefits of a brain pacemaker?
Of course. The Parkinson disease, especially, we are using the pacemakers, and the Parkinson patients has a tremor. This is known as the shaking illness, and the most common patients complain is tremor. And then, of course, they are walking disturbances. It's called bradykinesia, and then they have a stiffness. It's called rigidity, and then approximately 80% to 90% of cases are stopping tremor after getting the pacemaker, after getting the movement disorder surgery, and then 60 percentage of patients are getting benefit for rigidity and bradykinesia. I mean that the walking disturbance and the stiffness of the stiffness in the body. So the patients are getting the increasing the quality of the life. It means that they are care themselves with this pacemaker. Otherwise, these patients are need to care of another someone. So we are making this operation for patients uh, to take care by
Of
themselves.
themselves.
Yeah, yeah.
When we talk about these diseases, the brain pacemaker is 100% safe. It can treat the patient to 100%.
Of course, in medicine there is no 100, but we are saying that 80 percentage or
99.
90 percentage, yeah, you will get the benefit from this machine. Actually, these patients are suffering from the medications too much. They are taking pill per day, 20, 25 pills per day. So
A
after
person who
this
suffers
surgery,
from Parkinson disease takes 25 pills per day?
yes, yes. So it
Wow.
giving the harm to all the body, kidney problem, liver problem. So after this surgery, we are dropping the approximately half 50 percentage decrease the pills required. So uh, of course the patients are getting benefits in the after operation, but actually if you ask me as a doctor what is the most benefit from this surgery is dropping of the using pills.
So we have the brain pacemaker or 25 pills per day. So we choose the brain pacemaker, right?
Yes, right, yeah, that's true. Yes,
Doctor,
that's true.
please tell me in what period of Parkinson's disease should brain pacemaker treatment be applied?
uh, Although no complete consensus was made in Parkinson's disease, the pacemaker therapy is applied in early and late periods of this disease. But we don't apply this installation of this IPG. IPGD means the battery of system to the patients above 80 and bedridden patients. So we have to, we can be late if we saying that after 8 I can take this operation. It's late because the operation is not complicated for patients, but after 80, the patient has a hypertension, cardiac problems, and getting older problem. So we are not inserting this battery pacemaker above 80, and it's required to perform this surgery for patient before his or her perception capacity decreases and he need for care does not increase.
I understand. Please tell me, doctor, are there any risks when we talk about brain pacemaker surgery?
Of course, everything has a risk, but the risk is very little in this surgery. Uh, and if, for instance, I am making the tumor operation, brain tumor operation, and we are saying that to patients 3 or 4 percentage, you have a risk in this operation, but in the this movement disorder surgery, just 0.7 percentage risk in this operation. It's a very little risk if we think about the surgery, all the surgeries. Surgery is about 10 hours in the past, but right now we are finishing the operations in 3 to 4 hours, especially in complaint of tremor recovers, and so the surgery risk is, if you think that all the surgeries, this surgery risk is very low, just 0.7 percentage,
Doctor,
very low.
please tell me, once the pacemaker, brain pacemaker, is installed in the patient's
Patient.
head, can
Mhm.
he or she function like a normal person?
Of course, I have a lots of patient, teacher, student, and squash teacher, and physiotherapist, and in every part of the population, I had a patient. So the patients are going their life uh, like normal people. They have no any obligatory or
That's a great news. And my last question for you, doctor, how long does the pacemaker last?
sorry, can I take this
How
question again?
long, how long does the brain
Oh,
pacemaker
okay.
last?
Okay. In the past, we have to change the brain pacemaker in every 3 or 4 years. But right now, these systems are going 10 to 25 years in the body of the patients, and because technology is increasing. So in the past, my battery was like this, but right now it's okay, like this.
Okay.
So it's very getting smaller. Even I know that in the future it will be half of this, and then the long life, long the pacemaker will be in the body. I think in the future, but right now the pacemakers lasting in 10 to 25 years later.
So a checkup control must be is recommended to be done after 10 or even 25 years, you say?
Yeah, we are making control. In
Okay.
the past, we are calling the patients in our polyclinic, and right now we are checking the people, patients with the Bluetooth technology, and we are inserting connect to people over the internet, and using the Bluetooth technology, we can check the battery systems easily. We don't need the patients just near us. We can check the patients in our home, in their home. I'm sorry, in their home.
I
So
understand.
the patients does not need to come to Turkey after installation, or does not need to come to hospital.
Thank you very much, Doctor, for all these informations you offered to our Romanian viewers. Have a nice day. It was a
Thank
pleasure
you.
to talk to you.
Thank you very much. Thank you very much. Have a nice day.
Bye bye. A fost
Bye.
așadar, doamnelor, domnilor, profesorul dr. Akin Akakin, neurochirurg. Am vorbit despre ceea ce înseamnă tulburările de mișcare, niște boli neurologice destul de periculoase dacă nu sunt tratate la timp și așa cum trebuie. Până la o altă întâlnire cu un alt medic de top din Turcia, vă doresc numai bine, la revedere!